This oral presentation of my practicum titled Making the Healthy Choice the Easy Choice for Hospital Employees. My name is Marlon John, and I will graduate in a few weeks from Liberty University with a master's degree in public health and nutrition. Um, a big part of the initiative for me to do this research was the growing recognition that our environment largely determines our food choices, and nowhere is that more evident than in a hospital setting, particularly how it impacts the hospital employees. As we move to the next slide of the overview, I'll discuss basically the purpose, the design, the accomplishments, go over the conclusions. I'll make some recommendations, I'll summarize it, and then I'll share references. So next to the first slide, the next slide is purpose one. And you can see that the unhealthy food environment costs billions, and that's a big B. As you can see, the slide from the USDA, how our food environments affect obesity, type 2 diabetes, and essentially heart disease. As you can see, the cost of all of this is in the billions of dollars. We'll move to the next slide and we'll look at purpose two, since the data was taken from the United States Department of Agriculture, and we look at the reasons for improving food choices in the workplace. So you can see on the slide titled Purpose 2 that employees spend most of their waking hours at work, and where food is eaten during the day. So it's a critical part of their health is the food eaten at work. Obesity continues to increase. For example, in 1999, the obesity rate in America was 30.5%, and in 2016 that rose to 39.6%. So as you can see, there's a growing trend, and we need to address this maybe at the micro environmental level, and hopefully extend it to the population level. All right, so the next slide, looking at the design, looked at 22 peer-reviewed papers that were published in 2013 to 2018. These are all peer-reviewed or government resources. I also was able to access data for the Stanford healthcare employees and also the Children's Hospital as well. And in addition to that, also we did 3 surveys. The first survey was that health risk assessment from the hospital employees, but there was a second survey we did that I conducted through a nutrition workshop, looking at individual employee nutrition making decisions. And then the third survey we looked at essentially overall communication around healthy food in the hospital setting. So main accomplishments was from this research was basically raising awareness. I felt like we raised awareness about the lack of healthy options in the workplace, and the importance and the impact of the food decisions, food choices that hospital employees were faced with in terms of trying to live a healthy life. I met over 200 employees. Also was able to get to know them on a first name basis, and I felt like we made an impact. Look at the conclusions from the research. The first one is the built environment. Increasingly, the built environment has a major impact on our food choices. For example, if you walked into a cafeteria and the first thing you saw was a sign for donuts, you're more likely to make a healthy food decision rather than if you walked in and saw a sign for a salad or an apple. So the built environment plays a critical role in our food choices. The second one was sugar-sweetened beverages. It's everywhere. A lot of the research that I looked at, and also the nutritional scans that I conducted, essentially, sugar-sweetened beverages was everywhere, and it certainly can greatly impact our health. For example, in a study done by Sanjay Basu at Stanford University that covered over 175 countries, the results show that for every 150 calories, or essentially a can of soda or a glass of juice that was available per person per day, the prevalence of obesity diabetes increased 1.1%. As you can see, it has a major impact on the population level. And the third conclusion is that a need for better organizational communication around healthy food options. If there are healthy food options available to an employee, but they're not aware of it, they're not able to make a healthy food decision. When we look at the next slide, recommendations. The first recommendation was to try to modify the environmental, so making a dietary environmental modification rather than focusing on an individual. For example, you're able to scale this at a large level, or make it by designing maybe the cafeteria in a way that the employees are more likely to choose a salad rather than the can of soda or juice. So making environmental dietary modification can have a major impact, and it costs less than half than combined interventions. Second recommendation is reducing sugar sweetened beverages. For example, um, the Cleveland Clinic phased out sugar sweetened beverages from the cafeterias and vending machine, and in the course of 15 months, the employees lost 180,000 pounds. So you can see a critical part of this is definitely trying to reduce sugar sweetened beverages. The third is involving managers. Managers are critical to the success of making healthy food decisions. Studies show that only 41% of managers think that employers are responsible for making healthy food decisions for their employees. So bringing managers on board is critical for the success of increasing healthy food options in the workplace. Fourth is improving organizational climate around healthy eating. So making the use of the company intranet or social media to alert employees of the healthy options that are available for them. And the final recommendation is using behavior theory. Critical, these interventions are using science-based methods rather than fly-by-night methods. It's critical to the success, because you want to base everything on science rather than maybe what's popular in the media. So as you can see, so what I'll summarize is that obesity is at an all-time high level. Hospital employees, the medical cost for hospital employees is 10% higher than the general U.S. workforce. So a critical part of it is reducing this the disease burden for the employees and hospitals is to make the dietary modifications in the workplace, to get managers involved, and to increase communication around healthy food options. If we can do all of that, we can improve the employees' health in the hospital and make the healthy choice the easy choice for hospital employees. And not only will this benefit all the hospital employees and increase profits and reduce absenteeism, but at the population level will also have a major impact in the community. Thank you so much.